It's not about what the person knows necessarily. We can teach people science, but you can't teach the communication piece.
Welcome to Medical Sales U. I'm Dave Starrett, your host. Today's guest is Sara Johnson. She's won a number of awards and she works in oncology here in Columbus, Ohio. Sara, great to have you on the show.
Great to be on. Thanks, Dave. Thanks for having me.
Sara, we have your name has come up, and you've helped mutual friends. They've mentioned you, and so it's just an honor to have you here. I was looking at your LinkedIn. You've won a number of awards, Circle of Excellence for this last year in 23. You currently work for Pfizer that acquired Seagen, so you're with Seagen, but can you tell us a little bit about what you do? I know we probably can't go into the specifics of everything, but tell us a little bit what you do.
Sure. Again, thanks for having me. And so I am in an oncology sales position, to your point with Pfizer. And what I do is I go to oncology offices throughout the central Ohio area, and I educate clinicians, whether it's physicians or nurses. My role is to kind of take what the FDA has approved and educate the physicians so that perhaps if they have a patient that needs that type of treatment, then they know what they need to know about using it, safety management for side effects. And it's a really rewarding job just because I know that we can make a huge impact on patients and families. So, and I've been, again, with Pfizer for about 2 years now, just with the acquisition of Seagen here, so.
Oh, that's great. Now, with Seagen, I guess you started right around the time shortly before the acquisition. Is that correct?
Sure, yeah. So I started with Seagen, and just about, I think it was like less than a year, the acquisition was announced. And Pfizer wanted to acquire the company, and it's been a really great transition and working with the company. Really, at the end of the day, we want to be able to do more research, and mergers like this or acquisitions really help companies see a vision and be able to follow it through to find an end goal for hopefully curing whatever the cancers we're working on. So
yes, well, that's a great acquisition. I know a lot of companies were interested in Seagen, and maybe you could just tell us a little bit about what does your week look like for for part of our program here. We have reps that some are interested in going into something new, right? Like a new division. I've had a lot of medical device reps ask me about how do you get into specialty oncology? What does that look like? What does your schedule look like? But then there's others who are brand new, have no experience, and they're wanting to kind of break into the industry. And they're trying to decide between medical device or specialty pharma or diagnostics. Tell us a little bit what your week looks like as a oncology sales professional.
Sure. Great question. I think it really truly does vary. I've never been on the medical device side, but I have done a diagnostic for breast cancer patients as well. And it varies so much because it's really what on the need of what the customer as our physicians need or what they're interested in. So for my week right now, a typical week would look like I would have several lunches, pending an office allows lunches now. A lot of things have changed via COVID because we can do things virtually, but for the live lunches, they're great opportunities for me to go in and meet a staff, but I'll have a couple lunches a week, perhaps a couple snacks if they're offered. Sometimes we'll do those in the afternoon to be able to let a clinic slow down from their patient load during the day. And then we can go in and sit down and educate on, again, the information for the treatment that I promote. But other than that, sometimes we don't have those scheduled things. And that can be a little tricky because then you have to navigate your day and make best use of your time. And so I will say that when I first started in pharma, I wasn't in oncology. I was a primary care representative and I specialized in urology. And this was 16 years ago. So I've been in the pharmaceutical industry for 16 years. And the day there was drastically different because I had samples that I carried in my bag. And so for those that are looking to get into, primary care is a really kind of good segue into the pharmaceutical industry, because you learn a lot. You really do. And you have to grind because you're leaving samples and you're getting signatures. And perhaps that's changed even since I was in that side of the business. But when you get into a specialized like oncology, and I love this space of pharmaceuticals, it's a little bit different because I don't have a sample I'm leaving. I have literature for patients, I have education for physicians, and so the conversations might be a little bit more lengthy because there's a little bit more that we might be discussing, comorbidities that are involved with the cancer itself. So the circle back. So a day could be me merely driving around Ohio. I have a strategy. You know, we have information and targeted accounts that we try to work with, based off of knowing what their history is with using the treatment or not. But I might just drop into an office and say, can I leave this for a physician, or can I speak with a nurse? Some days are really, really productive with getting feedback from people. And some days I'm just showing up to an office and doing a lot of drop-offs. But
Yes. How big is your territory when you say you're driving around? What does your territory look like for an oncology rep?
So for oncology rep, in my experience, you tend to have a little bit larger of an area. So my area encompasses most of central Ohio. I go up, I think my furthest account is about 2 hours away. But I go north, south, east, and west of the Columbus area. So it can be, there's a lot of drive time involved. So you do have to be strategic with your day, starting early so that you can get out into the office when they open, or shortly after. And so I have a decent sized territory, but there are some oncology reps that cover states. It all depends on the size of company you go with as well. I mean, Seagen and Pfizer is it's a larger organization. The smaller private mid-sized companies might not have as many representatives, and those are the companies I tend to see have larger territories.
That's excellent, and similar to some of the roles that I've had in the past as well. You've you talk about starting out, and I guess you were calling on internal medicine physicians when you first started out. You had samples, and now you moved over to specialty with oncology with cancer. I think in the device, some of our listeners they start out with no experience. They go into an associate role, and they have the desire to move into a full line rep and device. But the pharmaceutical route that you took, tell us a little bit, maybe take us back then. How did you even first land your first job in pharmaceutical sales? Do you remember the interview process and this? What did that go like? Because there's a lot of people, sometimes that first job is the hardest.
Yeah, absolutely. And I'll actually rewind back to college. When I was still in college, I'm a communications major. So one of the questions I frequently get asked when I say I do pharmaceutical sales is, what did you study in college? And I say communications. And I think a lot of people are shocked at a lot of reps don't have a science background per se. And not to say that some don't, because I have worked with some really stellar people that have biology backgrounds. So, but in college, I knew I wanted to be a pharmaceutical rep. My dad was a colorectal surgeon. And so I was always in the offices, and I had an interest in the medicine. I just didn't think I was cut out to be a doctor myself. I'm a people communications type person. The science with that was just, I knew where my spot was. And so I knew back then, and again, times have changed, but I was willing to do whatever I could to get in and on my own. And there was an organization back then that offered a course to take, and you get a certification, and that was supposed to kind of give you a leg into to pharmaceutical. And so I took it, and I took the test. And after I graduated, I just started applying to all the different pharmaceutical companies. And at the time, a lot of them wanted years of experience. And my thing, and that's why I try to help as many people as I can, you can't get experience unless someone's willing to give you a chance to get it.
Absolutely.
And that's my passion for helping people I meet. We'll get into that in a minute. But so I applied, and I just kept getting shot down because I didn't have experience. And so I looked at the job requirements, saw they said sales, and sales experience required. So I got a job as a recruiter, and I did recruiting for 3 years. And I was like, I've got my sales. And then Paychex was a company that came up, and I said, well, maybe I'll learn about the insured side. Maybe that will help me. So all along, I was trying to think of what stepping stones could I put in front of myself to eventually land into a pharmaceutical role. And my first job was with GlaxoSmithKline, and they had an opportunity, and I interviewed. And I'll never forget, Dave, one of the folks I interviewed with said, "What have you done to prepare for this interviewer, and or to get into pharmaceuticals? Tell us what you've done." And I said, "Well, I took this course, and the gentleman, very very great leader at the time. I remember he'd said to me, you know, you probably got scammed, because
Oh,
I don't even know what that is." And I said, you know
really?
what? Maybe I did, but I'm willing to do whatever I can to get myself one step further and closer to pharmaceuticals.
That's
And
good
so
response.
that was my first job. And I was very fortunate because at the time it was a primary role. I was hired as primary, but a urology specialty role opened up, which typically they required the background. But I went to my manager at the time. I said, I know I'm new, but I'm very moldable, and I will learn, and I have no bad habits to break. And so they took a risk, and they put me in a urology specialty role. Um,
Wow.
and I was very blessed, and covered that was when I lived in Florida. So it was most of the Southwest territory of Florida.
Okay.
But yeah, and then from there, that was a sampling. It was a sampling heavy job.
Now, were you calling on both the communities setting, like the Florida Cancer Specialists, and also were you calling on like academic
So with that,
institutions or
position was specifically family practice,
family
general.
practice? Okay.
Yeah, that was internal. It wasn't until 4 years later was when I applied for an oncology role.
Okay.
And at
That's
that point, then I called on all the Florida Cancer Specialty. I didn't have any academics at the time
okay.
because of where I was in the Southwest Florida. I didn't go as far as Tampa, so there was no true like large academic in my territory. So
Well, later on, what motivated you to move into oncology? There's a lot of places you can go, but why cancer?
well, at the time, I just knew that there was so much going on and so much evolving in cancer. So to be brutally honest, at the time I made the switch, I was looking for something new. So I wasn't like, it wasn't a full targeted, like, this is where I definitely want to go. A colleague of mine came to me and said, this is an opportunity. I think you should go for it because I think you'd be good for it. And I said, sure, why not investigate it? And I did. And I was so glad I did because um, during my oncology time down there, my company did get acquired by another organization, and the territory was I don't speak Spanish, so Miami was not my forte, and so I explored some other opportunities. And at the time, I had two companies I was looking at, and I thought, what am I going to do? Because I really liked both of them, but one was diagnostic and one was drug, still the pharmaceutical side. And unfortunately, my mother-in-law was diagnosed with breast cancer literally the week I was offered the jobs.
Wow.
And so that was my guiding light as to which opportunity to pursue. And ever since then, and that was upwards of 10 years ago almost, that has been really why I've wanted to stay in oncology. And I love what I do because I've met so many people along the ways that have their lives are truly affected by cancer and oncology, tumors, all different types. And so I feel like I have such a huge impact. And I felt in that position, I was able to learn so much about breast cancer so I could help my family navigate through that journey. So
Excellent timing for you to receive that offer and be able to help
sorry.
representative for lung cancer awareness. Can you tell us a little bit about your personal journey,
Sure.
struggles, loss, and that, and why you're passionate about lung cancer?
Mm-hmm. So in 2021, my father it was actually my father, and he had, as a colorectal surgeon, he just retired.
Okay.
And within a year, he was diagnosed with non-small cell lung
Oh,
cancer.
it's your father. Wow.
Yeah. And so he was diagnosed with non-small cell lung cancer, and he was down in the Florida area. And at the time, I was with a company called Bristol Myers Squibb, and I had great opportunities to I was actually working in the lung space. And that was up here in Ohio. And so I had learned so much about lung cancer prior to this diagnosis for my own father. And man, was it just eye opening to be on the other side of the story of what my day to day is. I go in and I tell these people in the people in the offices as to what this treatment can do for their patients. And now I was on the other side with my family,
Mhm.
looking for the best treatment for my dad. And it was 2021, and unfortunately he lost his battle last year,
Wow.
just July of 23.
So he battled it once he was diagnosed. He was battling for about 2 years.
Mhm. He was an earlier stage. He was stage 3 with his first diagnosis. Went through surgery and chemotherapy. And then when it came back metastatic, there were a lot of options. And, I covered parts of Florida, but I hadn't covered the areas he was in. And since I knew a lot of really brilliant minds up here in Ohio State was where I ended up having him requested for him to be treated. We had him flying up from Florida to be treated at the Ohio State University.
Okay.
And so the impact of what I did had a whole different value now, and made me super passionate about making sure, even when it's a rainy day, that I want to get out, because it could just be someone that walks in that office that day, because that could be someone's dad like mine.
I love that.
So, and the lung cancer awareness ribbon you see there, it's called the White Ribbon Project. And it's a nonprofit. It's an organization that literally started creating these white ribbons, and they distribute them for free all across the country. And the hope is that we just spread awareness around lung cancer, because we hear a lot about breast, which also deserves its own space, because they're both deadly diseases and they affect millions of people. But lung cancer is, we want to get it up to that same space, because there are so many people affected by it. And it was hard to lose my dad, and it was hard. I won't lie, it was hard to be in oncology offices some days.
I can't imagine that being so short in that. I talked to this about, to my wife, when she was a little girl, her mom, who was extraordinarily healthy, seemingly, and a well-known interior designer here in Columbus, she died of lung cancer. She was a non-smoker, and it happened quickly. And so my wife, now being a mother of little kids, has those memories that she's even went through some counseling because of these memories. And I know, I lost my grandfather to lung cancer, and I lost an uncle to lung cancer. But you're right, as far as like the awareness and the basketball players wearing pink, and the braces and everything, there's a lot of awareness of breast cancer, and that's excellent. It's wonderful. We need that. We need that.
All of them, yeah.
But we need, and I like this advocacy for lung cancer, because it doesn't get talked about quite as much. And your father, you said he was a physician. He was an oncologist. Is that what type of
No,
physician?
he was a colorectal surgeon.
Colorectal surgeon
Mhm.
in Florida.
Actually, his practice was in Buffalo, New York, which is
Oh, it was in Buffalo, New York, and then you moved to Florida.
yes. I'm not a cold girl. I like the warm weather. So,
Yeah, I'm
yeah.
the same way. I moved here from Texas 3 years ago. I was working for Foundation Medicine out in Texas, working, calling on both the academic and community setting, UT Southwestern, Texas Oncology. And it kind of gave me a broad overview of all cancers. And then during COVID, I had a long distance relationship, decided to move here, get married, and got married in 2021. And, my wife loaded me up with Buckeye gear. I didn't have a chance, but, go Bucks, OHIO, I embraced it. And you've mentioned, names, at the James Cancer Center. And so I really, truly respect the work that they're doing over there at the James. Sara, there are, people who are considering this profession, and maybe they don't have a story like you, losing a father. but they're interested in helping patients. They have desire. They're trying to explore what is the future in store for me. They're interested in pharmaceutical sales. They're interested, in helping cancer patients. But there's a lot of habits that take place in order to prepare oneself. You mentioned that you had a communications degree. You said you didn't have a biology background, but you had a communications background. What advice would you give to someone in their 20s? Maybe
Sure.
they're about to graduate, to get prepared, some characteristics that would help them to prepare, to go into this profession.
Um, it's going to be kind of a loaded answer because there's a couple things I think
No.
really. I've worked with a couple folks, and I think networking is crucial. LinkedIn is a great source of networking. I know I mentioned before, back in my recruiting days, I was on LinkedIn back in the early 2000s. And I remember people would say, "What is LinkedIn?" I said, "I can search for people and I can find them." And, I think the more you know folks, so in the past, when I've been interested in a company or an opportunity, I dig in. I sit there, I research. So for new folks that are looking, research the companies, find out who's in the company, what their background is, how long they've been around. Do they match what you really feel like you'd be passionate about? Because that's important. I mean, my dad used to always say, while he supported me, he's like, "I was kind of shocked that you ended up in this position because you didn't have a medical background." He said, "I met with a leadership after you got the job, and they said, from a pharmaceutical company, they said, it's not about what the person knows necessarily. We can teach people science, but you can't teach the communication piece and being able to relate to people and understand and respect, because when you're in an office and a customer is really busy, you have to be able to read their body language and understand today might not be the day to push forward with a little bit more extra information. Don't be on your own agenda." And the same kind of applies when it comes to wanting to learn about these companies. When you're talking to people, talk and learn. Like, listen, open your ears to soak it all in. And the gentleman I just worked with, really awesome dedication and passion for wanting to learn all aspects of this industry to decide. And he did it right. He didn't know, did he want to do device? Does he want to do diagnostics? Did he want to do drugs? And he put a lot of effort into learning about it. And so I would highly encourage anyone interested to kind of do the same thing. Research that, decide, do you want to be in the sampling drugs? And what's your goal? Do you think maybe down the line you would like to do specialty? Because it does change your day to day a little bit. But so the networking piece is huge. And the other piece is being able to show your passion for it too. I know I keep referencing that, but you have to put out what you want to get back to.
Yes.
You can't expect that you're just going to apply for a job and waltz in. Like, what is going to make you different from everyone else that wants that same job?
What will make you stand out against those who do have experience?
Yeah. So, what have you done? Have you perhaps, and this is just my opinion, obviously, it's not, I'm not speaking for the companies that I've worked with, but, maybe it shows that you've gone out and you volunteered with some of these lung cancer or cancer organizations that are awareness. Do you get involved as a volunteer? Do you do the walks for them? How have you supported this industry when you didn't have to because you were getting a paycheck from it? So what things have you done there? I mean, but I think really for these recent grads that are coming out, research the companies. And then with the LinkedIn piece, find people. Don't be afraid to ask someone and say, "Hey, I know you don't know me, but I'm about to graduate, and I was wondering if maybe perhaps you'd be willing to talk to me about what you do, because I have an interest in it."
I like it. And you were recently helping a mutual friend. And did that person reach out to you on LinkedIn, or did you know them through a mutual?
So interestingly enough, we go to the same church,
Okay.
and so that's how we were connected. And again, I've met other folks too. I mean, crazy enough, I met a lady on an airplane years ago in 2021. Met a lady on the airplane. She said, "My niece is interested in getting into pharmaceuticals." And I was on cloud nine. I just found out I'd won the trip from the year prior. So I was on a meeting and I hung up and I said, I'm so terribly sorry. I didn't mean to be rude. I was on a meeting. It was exciting time. And she said, my niece is interested. I told her, I said, have her look me up on LinkedIn or reach out. And the gal was out in Chicago. And we reached out and we talked, and she showed the motivation. She messaged me. She said, what works for you? Because she wanted something and she was going to get it. You know what I mean? So she put a lot of work into it. And I worked with her. I helped her with her resume and kind of coached through interviews. And she now works for a pharmaceutical company. Now she's not in the sales side, but she's doing marketing. But it's really, for me, it's satisfying and gratifying to know that I didn't know her prior to that, but it helped her get her foot in the door. And back when I was doing it, that's all I wanted someone to do for me. So you just have to be bold enough to say, I know you don't know me, but can you help me? And some people might say yes. Some people might not respond. I'm going to be honest. There are people that might not respond. Don't get stupid. Because in our job, and if you want to be in this industry, you have to know that no can't be the end of your journey with that person sometimes.
And you have to do the job to get the job. And then the thing is with all this, you've brought about 5 really good points here. Number 1 is this enthusiasm. And 2 is taking a proactive approach, using LinkedIn. Part of our program is we're helping people to use LinkedIn, but taking it a step further, asking to meet the person, see if you can meet with them for coffee, meet with them, and don't say no for them, because you never know who's going to say yes.
Yeah.
And you will always be surprised. And will they get no's along the way? Of course, because that's part of sales. But then you can come back later, and that's what we do day to day. You mentioned something about just being aware and observing the office. And if the physician is extremely busy, it's not a good day, you have the emotional intelligence to know, now I don't need to push here. I need to know, I need to leave this account, go work on these other accounts, and then come back. And that is selling. And in order to get this job, you're going to have to do that with LinkedIn. And with also you mentioned, Sarah, something excellent. And that is knowing about the product, knowing about were there clinical trials with this particular drug, and the people that you're reaching out to. And I think all of us, we need that in this industry. We can't do this alone. We have to collaborate. And once we get in, we need to collaborate with our colleagues and other people as well, because access is tough. And I just really appreciate you taking the time to give back. I think for our viewers, they're going to take away some really good points.
Well, I'm really happy to be on here, and anyone that's watching, I'm always happy to help. I mean, everyone deserves a chance, and that's we all need each other, to your point. So
absolutely. 2 more questions.
Yeah.
Number 1 is for personal development.
Yeah.
Are there any books or anything that you've personally have read or listened to the audiobook or anything like that in the last, say, year that's a good tool, or maybe just something kind of fun that you would recommend? Maybe it's not specific to medical sales, but you could recommend that to our
to be honest, with all the drive time, and I do have 3 little ones, I don't get a lot of reading in. So I do a lot of podcast listenings. I'm not one specific, but I am huge. And I love, not just because of what I do, but it's just an interest for me. You mentioned it too earlier, emotional intelligence. Like, I just think it's fascinating learning about my own personality and what I relate to, but everyone else around me, because it's going to help me with my better my relationships with friends, with colleagues, with whatever, my entire life. So I'm really big on learning about emotional intelligence and, leadership. While I'm in a role now that I'm not leadership per se, I still am a leader in my life in a lot of ways. And so I like learning about how to be in a role like that, so that I feel like it's something we could all use, whether you're actually in a leadership role or not. So again, I don't have a specific podcast or book, but I would
learning
too. There, I'm blanking on the name of it. I have it up in my bookcase, but I would also recommend that for anyone who hasn't done any of the evaluations, to identify what your emotional intelligence is. There's DISC evaluations, because I know a lot of companies do color charts for your personality. it's great to know that going into an organization so you
Yeah.
can tell them what your strengths are.
Yeah.
Um, so
I like the Strength Finders. That's the one that I
yes,
use.
that was what I was looking for. Strength
Strength
finder.
Finders. Yeah, Strength Finders. I use that and I even put it on my resume. And so I definitely recommend that as well. Okay, one other question here. For fun, when you're not working, you mentioned you have three little ones. I'm sure that takes, what's the age of your kids? And my question is what do you do and your family do for fun when you're not working?
So I do have three little ones. I have two girls that are 9 and 7, and then I have a son who will be here 6 in the next month. So it's a full house.
Yeah.
We also are big animal lovers, so we have two large dogs and a cat. And so when we're not at school and work, we're a big musical family. So music is a
Music.
big part of my life. And so I'm usually, most people that know us know we
What,
want.
what instrument do you play?
So I play a couple, but I'm a vocalist is my main,
Okay.
so singer, and then I trained on violin for about 18 years. I play violin, sax, piano, and guitar. So I'm
Love
kind
it.
of raising my kids to be their own little band one day. But so we're big into music, but we volunteer with a local group called Stop the Suffering for animal rescue. So we foster on occasion. And but for the fun piece, that's not something of that sort. We love to travel. We have a little cabin that we purchased, so we like to get away into the woods when we can. I like to get to the beach when we can. So we're a very traveling family. People that know us well know that we're always on the go. So
Wow.
yeah,
That sounds fun. Well,
yeah.
Sarah, it's been great having you on the podcast. Thanks for sharing your insights. You're going to help a lot of people. You already are. And just also, I mean, juggling being a mom of three little ones and your involvement in a disease outside of what you sell and lung cancer is, a great example for us to learn from. So thank you so much, Sarah.
Yeah, thank you for having me, Dave.